Hello, and welcome to the poster, Simulation-Based Training of Critically Ill Patients for Novice Nurses in the Pediatric Emergency Department. We are Christine Tamburello and Josh Logan and are both nurses in the Pediatric Emergency Department at the Johns Hopkins Hospital. A few years ago, we noticed a disparity in the care of our critical care patients amongst nursing staff. Many novice nurses self-reported that they did not feel comfortable in taking care of these high acuity patients as they had limited experience and no formal orientation for how to manage these patients. As a result, they often avoided critical care situations and continued to lose out on great learning opportunities and exposure to this vulnerable patient population. In order to help this group of novice nurses gain experience in a safe and controlled environment, a simulation course focusing on nursing management of commonly seen critically ill children within the Pediatric Emergency Department was created. The simulation courses typically consisted of 6 learners, Josh and myself as the scenario facilitators utilizing high-fidelity mannequins, and a physician to include a multidisciplinary approach. Pre-surveys were completed to evaluate which specific critical care skills the learners wished to practice. The scenarios created focused on these skills and used rapid cycle, deliberate practice to allow the learners to perform specific skills repeatedly across each simulation to build up upon their knowledge and comfort. The commonly requested skills included rapid fluid administration, adenosine administration, prepping and performing intubation, and management of a difficult airway. The use of rapid cycle deliberate practice also fostered critical thinking skills, team dynamics, and communication during stressful, high-intensity situations. After each scenario was completed, a formal 20-minute briefing session would be conducted and led by Josh and myself. The debriefings focused on discussion of the medical management of the patient, how the nurses felt with the skills, and critical thinking associated with the scenario, as well as ways to improve for the future. This allowed the learners to reflect on how they performed and to utilize a retrospective vantage point for further learning. The debriefings also allowed for additional practicing of clinical skills that the nurses felt they needed clarification on, as well as providing supplementary didactic information. Upon conclusion of the course, a post-survey was immediately administered to evaluate the effectiveness of the intervention. Qualitative self-assessment from participants demonstrated improvement in all metrics after the simulation course relative to pre-course values. The data also demonstrated that the learners as a whole would be more eager and willing to act as the bedside nurse in a critical care situation as a result of their improved confidence felt from participating in the simulation course. An additional post-survey was completed at 6 months post-intervention to further assess retention of learning. This data showed a slight decrease in reported self-confidence across the majority of skills, which demonstrates the need for continued simulations and scenario practice after the initial course takes place. Continued simulations at regular intervals also further promotes ongoing learning and retention, as the opportunity to care for critically ill children in the PEDS can be low in frequency. As a result of this simulation course, approximately 1/3 of the Pediatric Emergency Department nurses have now received a more formal orientation for the management of the critically ill child and was reported to be a valued learning experience for the majority of those who participated. Going forward, the simulation course will be a part of continuing education for this designated nurse group with the hope to reach as many PEDS nurses as possible. Josh and I look forward to continuing to develop and expand upon this course and are excited to offer this valued resource for future nurses. Thank you for visiting our virtual poster, and please feel free to contact us with any questions or recommendations.